There are three aspects of facial aging. One of them is changes in skin quality. The second is change in facial volume due to fat loss or muscle loss or even bone loss to some degree. But the final one is facial laxity. When we develop facial laxity, what happens is that volume that used to sit very high up in our cheekbones and under eye tends to drop. And that leads to heavier folds around the mouth called nasolabial folds, folds from the corners of the mouth down to the chin, and also soft tissue draping over the jaw. We call that jowling. We also get banding and laxity in the neck. So what a deep plane facelift does is reposition the tissues and treat laxity really effectively. And for most people, that involves a deep neck lift, a deep plane facelift, and also a brow lift to take any heaviness from the temple area once we've lifted the other tissues. The term deep plane facelift can be a very intimidating term. It makes it sound like the surgeon is completely rearranging your face, which is simply not true. There are several layers to the face, but the two key layers are the skin and fat, and underneath that a layer called the SMAS. Older facelift techniques used to simply pull on the skin, and that gave a very windswept and unusual looking appearance. Modern techniques work on the layer called the SMAS, and I compare it to carpet and underlay, the carpet being the skin and fat. So in a SMAS plication facelift, the surgeon just lifts the skin off and puts stitches in the top surface to tighten it. In a deep plane facelift, we really don't even have to lift the skin off the SMAS at all. We can keep them stuck together and dissect underneath the SMAS and keep the two stuck together, and they move together. And with that technique, it means we don't really traumatize the skin very much at all. So in fact, it's less invasive. Deep plane facelifts are a core part of my practice and something that I do day in, day out. As you do more of any type of operation, you get better. You make small improvements with each case. When it becomes routine for us, it means that you get better care and better results. The ideal facelift patient is someone who really knows what they want, who's done their homework, and allows a two-way conversation where I can advise them on exactly what combination of procedures would benefit them. It's sometimes really important to combine lots of different procedures to achieve a very balanced and harmonious result. The facelift journey is actually a really structured process. From the first time you meet us, the 2 consultations, to when you book surgery, you'll have frequent contact with me and my team. My specialist nurse Laura will contact you before surgery to go through the do's and don'ts and how you can best prepare for surgery. Then of course the surgery happens, and then I'll see you the next morning to make sure everything is okay. We take off the big dressings that you have on and put a much lighter facelift garment, which patients really love and feel very comfortable in. I don't use drains during facelift surgery, but I do use the hemostatic net, which are sutures that look quite strange, but behind your ears can look a bit like a Chesterfield sofa, but it beds the skin down and avoids the need for drains, which patients universally hate. Those sutures come out at day 2. At day 7, all of the remaining sutures that go along your hairline and behind your ear, they come out at day 7. In that first week, I recommend taking it quite easy. I recommend and encourage long walks, but not intense exercise. There are also things you can do to help swelling come down, help bruising, such as hyperbaric oxygen, and also manual lymphatic drainage, which really helps in the early post-operative period. In addition to the physical changes, it's important to understand that you might have highs and lows as you recover from facelift surgery. It's really hard sometimes to go from looking completely normal before your surgery to looking unusual or swollen or bruised after surgery, and you really have to trust the process as that recovers and you see the outstanding results that come through. Our team is there to really help you understand that process and be with you step by step along the way. It's fair to say that deep plane facelift results last longer than other facelift techniques. The mini facelift techniques, for example, can sometimes just do very small amounts of work around the jawline and often don't provide the long-lasting and powerful effects in the mid-face. The reason that is the case is because not only do we release any small ligaments that hold the SMAS fixed, it's also a tension-free operation. Face should look more relaxed. We're not stretching the skin too much. The skin simply follows the SMAS, which we're repositioning with a deep plane technique. There's less trauma to the skin. We're not separating the 2 layers, and we keep them stuck together. So in some ways, it's less invasive than other techniques. What really makes me happy is when patients come back to me and tell me and the impact that facelift surgery has had on them. The confidence, the fact that people have made small comments about how good and how fresh they look, but not necessarily realize that they've had a big operation. And so what that tells me is that they've achieved natural, authentic results, and one where you don't carry an operated look.